Transform Kenya. Empower our nation. Transform Kenya, brought to you by Standard Group in partnership with the National Hospital Insurance Fund, NHIF.
From Kenya, just a quick reminder, the hashtag that we're running is Empower Our Nation. You're welcome to participate in this conversation online. And right here, we do have a live audience. And of course, health is a multifaceted approach. It's not just one stakeholder or few. There are quite a number of them. And I'd just like to get comments from one of our people here. We have Saoyo Tabitha, who's a lawyer. She's also the Deputy Executive Director of Kelin, which is an NGO that deals with health-related rights. Over to you.
Thank you, Kitonga. Allow me to just stand. Central to the discussions on health for me is the paramount importance and the role that is played by patients and the community. And it is unfortunate that tonight's panel is missing that voice. Nevertheless, ladies and gentlemen, allow me to address myself to the following question. 2016 Global Vaccine Alliance, Gavi, issued a report whereby there was a scandal involving almost 160 million Kenya shillings that was missing. This money was subsequently reimbursed to Gavi by the Ministry of Health after this scandal was unraveled. In the same year, the Auditor General's report indicated some questionable scandals that were happening in the Ministry of Health. And these scandals ranged from imaginary health supplements that were being issued to persons living with HIV. And there was also the Beyond Zero maternal health containers that were somewhere rotting in Mombasa. 2017 and 2018, development partners, including USAID and Global Fund, also suspended programs at the Ministry of Health due to lack of transparency. Up to today, we are yet to receive a response or a report that shows people who have been prosecuted because of this loss of funds. Critical to this conversation is the fact that there's a woman who will die in childbirth, there's a child who will miss vaccines, and there's a healthcare worker who will not be adequately compensated because of the leakages. So my question, and NHIF is no better. So my question to the panel is, where are we and where is the justice for that person who will die as a result of these leakages?
Chairman, we'll set that question right straight to you.
That's a difficult one and puts me on the spot. But nonetheless, I think it is indeed true that there are issues that do come out from time to time in the press. I can't actually speak on some of these because I'm to some of that information, having come into the ministry fairly recently. We are aware that the ministry has received a lot of negative media because of these issues. I think the new leadership is focused on delivering health services to Kenyans and in plugging whatever that have been may have some of these the incidents that have been mentioned. I also want to elaborate that the freeze, for example, of the US government funds to the government is not necessarily, cannot be construed necessarily as a fraud, because it's an issue of accounting and what they call charging accounts in the wrong voice. And I think those things are under discussion with the USG government. Progress has been made, and we're looking forward to a lifting of that ban very, very shortly. But I don't want to sit here and tell you that there are no problems. I think, like in any other organization, there are bound to be problems. There are bound to be issues that are not desirable. The new leadership wants to ensure that we don't come across those kind of scandals anymore as we move forward. If you'll allow me, maybe I would also want to speak a little bit on I don't know if we've gotten to the UHC part yet.
Not yet.
Okay.
But I just want to do a follow-up. You've said that the ministry has been receiving negative publicity. Is it that it's negative media publicity, or is it that the media is actually highlighting the problem at the ministry?
I think the media has a role in informing the public, and we recognize that. That is a rightful role. But we also feel that at times the information is sensationalized without really checking with the sources. There are a number of incidents where that has happened. But that is not to deny that there have been real scandals that have emerged over time.
Okay. And Tabitha has mentioned that NHIF is no different, and even private insurers, where we have cases where we hear or we are told that hospitals will charge even 5,000 more on cases that are covered by insurance. When we highlight this case, or when they come up, then it's just negative publicity. But this is actually what is happening. But what is being done to safeguard Kenyans' money? Because this is taxpayers' money, especially when it comes to NHIF.
Thank you, Mercy. You realize having an institution which is over 50 years old, everybody will have a history, and there is where that institution has come from. But I would want to say maybe in the last 5 or 6 years, a lot of things have happened, a lot of change has happened. And I think the key thing is to focus on the positives, because again, if we keep focusing on the negatives, then we'll never make a move. But I would want to say that the institution is focused, geared to provide its members with the requisite services that they do deserve. Yes, there could be issues in the past, and I think that has been handled, focusing on the right governance, the right leadership for the institution to attain its mandate.
But I would think that sorting out historical injustices is a way to progress. We have to look back at what went wrong so that it can be rectified, and we can look forward. Because if we say we're just focusing on the positives, yet we have issues where big headlines, taxpayers' money could not be accounted for, then what safeguards do we have to ensure that in the future we'll not have those headlines again if we don't address what actually happened at that particular point in time? Dr. Kitulu.
Thank you, Mercy. And I think my two counterparts on my side who are under fire, unjustifiably, because, and they have admitted, yes, there have been issues. Well, one, I think that in terms of where those scandals arise, they are not in those scandals on their own. The participants in those scandals are also right here. I'm going to talk about the case of NHIF. How many patients will pretend to be other patients, on the NHIF card? That happens to the private insurances as well. So when we are looking at this circle of corruption or the scandals, it has very many participants within it. So it behoves us as well at our different levels, whether as the patients, as professionals who are serving those patients, and to be part of bringing out where those issues are. So we appreciate the role of media in bringing out some of those issues, but also take cognizance that we may be party to it. But going back to resolving some of those issues, again, goes back to that role of leadership and governance. What are the structures that have been set? So that even, as long as there's a vacuum, they say nature abhors a vacuum. So as long as there is no structure set to ensure, that I do not come with a fake card or I do not pretend to be someone else, someone will try to do that. As long as we have not costed what healthcare is, then I can charge, as a provider, I can charge anything under the sun for that. So again, it's going back to those policies. And some of those are an initiative as the Kenya Medical Association. One of the things we've been pushing for is saying we must cost healthcare. What is the cost of of dialysis? What is the cost of a cesarean section? So that, it doesn't matter where that service is offered, that there is a cost to it. That way it's of benefit to the public, it's benefit to the insurances, it's benefit to NHIF. There is more money out there to serve more people. But as long as we have loose structures, in terms of access, there are loopholes. In terms of costing, there are loopholes. You can charge whatever it is. In terms of even integrating the systems to collect that data and forward it to where it needs to be analyzed, that we haven't put that together in terms of an information system that links it. Again, more loopholes. Not that the information system in itself is a total solution, because when you look at banks, where do they lose money? It's through information systems. So, but then again, setting structures within that will ensure that we are able to pick up where the issues occur. Because so unless we set those policies, we'll always say a new set of leadership has come in, they're trying to correct what was there, but we'll keep on going back to the same situation.
And you've talked about costing healthcare, and the pharmaceutical industry is another hole that actually swallows almost 40 to 60% of healthcare money, where you have one antibiotic will cost 300 shillings, for example, in one pharmacy, then you go to another and it's 50 times that amount and it's the same antibiotic. And Dr. Vimal, you have been in the pharmaceutical industry for 30 years, and you have seen these changes, you have seen the prices, you have seen the loopholes in the pharmaceutical industry. What can we do to safeguard our costs, or to limit the cost that we are spending in the pharmaceutical industry?
Well, I think, first of all, we need to look at certain models that have in the world have been successful. For example, India, Bangladesh, UK, etc. First and foremost, we need to have local industry. It's beyond anything WHO has said. You have to have your own industry. The reason is that they have found in the world that countries having their own pharmaceutical industries bring down the cost. Now, there are a couple of things here. One is the local products as well as imported. We've done studies and we've found almost the same generic imported from India, China, or whatever, is 40% more expensive than local. And that has been seen in ChemServe statistics as well as meds. The other thing is that, so what I'm trying to tell you there is that we focus around that area. The second thing we've noticed that even if you do studies on multinational products in this country are usually more expensive than their country of origin. And by the time it gets to the end user, it's about 400% more expensive. That's a study done by McKinsey. The other cost that is unnecessary, no value addition, is from the manufacturer to the wholesale to the retailer, and you're losing a lot of money there with no added value addition. So we really need to think about what we really need to do is think about generics, quality generics, affordable generics. That brings down the price of that medicine cost, which is 40% of the premium.
Dr. Kipngetich, you're agreeing quite strongly with Dr. Vimal. Yes, let's hear your bit on this.
Okay, let me address some of the concerns he was talking about on corruption. I think we as Kenyans, we have to acknowledge that we have a problem. Because if we don't acknowledge that we have a problem, then we can't solve it. And that problem is corruption. If we don't go into the deep root of it and say, corruption distorts everything in our society. It distorts production, it distorts our values, it distorts everything, our pricings. So I am personally very happy that the president is saying for him to achieve his Big Four agenda, he has to address that governance question. And you have seen some of the results. He is very aggressive, and we hope he continues with that aggression. Because if we don't address that question, then a lot of the things, the progress we want as a country will be jeopardized. Even for us in the insurance industry, one problem, major problem in the insurance industry is corruption. And we are now open about it, at least us in Jubilee. We are open about it. We disclose. Recently, we disclosed to the public a person who killed a relative, so that then they can make a claim. Because if we don't talk about these things, we will never resolve them. So as we then open this conversation as a country, we are moving in the right direction, and we must address all these distortions so that by the time even you come now pricing issues and how we can address issues of generics versus branded items, you see, we have really hit the nail on the head by that point. And I agree with Bimal. If our country does not go the generic route, our impact in making affordable health care possible will be jeopardized. Because in the US, for example, in the US, 86% of the drugs dispensed are generics. In Kenya, it is 28%. Why that difference?
And I think
it becomes very expensive in our country to buy drugs, and we are a poorer country. How can a country which is among the richest in the world are able to dispense generics at 86%? It has a lot to do with counterfeits. So then people fear and they go to branded items. So if we address that issue of corruption and access of contraband, we then begin to tilt to generics. And we, for example, as Jubilee, we favor generics and preferably locally manufactured generics. So you have a win-win as a country. You're supporting manufacturing, and also you are bringing the cost of healthcare down. Because as we said earlier on, 40% of the cost of healthcare is pharmaceuticals. So if we make a dent, possibly bring it by 90%, because in my view, if we address that issue of counterfeits and go to generics, we will bring the cost of pharmaceuticals by 90% down. And you can see then affordability. Then we in the insurance industry begin to bring premiums down. And really that is the point that we must address. So then we are addressing the root cause of our challenges. Thank you, Masi.
But one of the things that is coming up is, for many Kenyans, there's a notion that generics mean, fake medication. And I'd like to throw this to Vimal to just tell us how as a layman, how do I know the difference between a generic and a branded medication, counterfeit, fake? How do I maneuver myself around this area?
Okay, so first of all, let me say there's a branded product, which is the innovator product, yeah? And they're the ones who designed the drugs, did the clinical studies, the research, everything. Then there's a generic drug, which is similar in its activity to a branded product. That is a generic. Then there is a substandard, which claims to be a generic of a strength, but it's really not that strength. Then there is a counterfeit. The counterfeit is something that is imitating the brand. So we're clear on that, right? So I'm going to put it to very simple. Many years ago, there was a company called Hoover. Hoover used to make vacuum cleaners. And as of now, if you even ask certain people, they'll talk about, I've got a Hoover. I've got a Hoover. But it's actually a vacuum cleaner made by somebody else, like Sony or Panasonic. So when I say this, is that first of all, there's a lot of branding that goes in by multinationals, yeah? And maybe they have their own agendas or something. But the generic version is what the other people, similar brands, similar vacuum cleaners, they're making to the branded one. So I think I can possibly relate that in terms of how the mass people will perceive it. I can tell you one thing, that, in the UK, back 30 years ago when I was working there, they went on generics. And they had a list which NHS used to disperse. America's done it. India is now going to push for it as well. So if you see this sort of things, it is happening. It's happening. The substandards, etc., so those are different. I can't comment on that. But I'd like to say one thing. Many of us prefer our food in our own kitchen, right, than going to a restaurant. So my thinking is that, if we're worried about counterfeits, substandard, it is easier to go to factories in Kenya, by the regulatory bodies like PPB, monitor it, than thousands of miles away in India and China.
Okay, and we have the pharmaceutical, the Pharmacy and Poisons Boards represented here, and we'll give them a chance to tell us why we still are battling with counterfeits and, substandard medications. But Dr. Mulo, from a county perspective, is it possible then to move towards generics as a policy if we want to reduce the cost of healthcare? Is this something that can happen? Because we know a bulk of healthcare services is at the county levels.
I think as a country, we are lucky to have big supply chain establishments, especially KEMSA and MEDS. And I think as county governments and at the Council of Governors and at the level of CECs, we are in agreement that there is value in purchasing from these two big supply chain suppliers. And one of the values that we are getting from there is, of course, the obvious, because we are able to get economies of scale, and we can be assured of quality. Because if we buy from everyone, and we actually talk to KEMSA, we talk to MEDS, and we advise them, they buy, and they are buying generics. They are supplying counties with generics, which is now acceptable. And the cost of commodities in the public health sector is substantially down. Mm-hmm. Commodities that you're able to get from the private chemists outside the hospital will be slightly cheaper, will be slightly higher than what we buy from these two supplies. And of course, some counties have been buying from private sector, but as Council of Governors, as CECs for Health, we encourage that we buy as much as possible from KEMSA. And KEMSA remains our first port of call whenever we want health commodities.
But you see, encouraging is not really having people buy from KEMSA.
I think as now the CEC for Makueni, I would say we 100% buy from KEMSA and MEDS. We are, and many counties are learning and realizing that you could make a lot of savings by buying from this. Then there is the advantage of you are not, because there is a problem that we must acknowledge of transparency, accountability in this country. All that means corruption, and that has been mentioned. That because our regulatory mechanisms, which should be able to guarantee every product that I purchase from any outlet is of guaranteed quality. Because we have issues of counterfeits, substandard drugs, we cannot guarantee what we get. And therefore, we feel as the other systems get strengthened, that there is value in these bulk supply chains, and that is what most of the counties are doing. Speaking for Makueni, we are buying 100% from this supply chain, and using these two agencies, we have been able to ensure that round the year, 1 year, 2 years, 3 years, now 5 years, we have uninterrupted supply of essential commodities in our facilities.
Okay, but well, that may be the case for Makueni, but the other counties may not really have similar, and you need to have uniformity because we are all in one nation at the end of the day. But I can see my panelists here are itching to respond to that. Allow me to take us to a short commercial break, and after we come back, we'll pick that conversation from there. So we'll take a short commercial break, and when we come back, we'll continue this conversation of Transform Kenya, the health agenda.
The Standard Group, together with our partners, brings you Transform Kenya Forums. These forums will bring together the public and various experts to offer solutions to our everyday problems. Join our panel as they discuss and share about health and the healthcare systems in Kenya live from the Strathmore Business School. Follow the conversation on our social media platforms and help build a stronger, healthier, and vibrant nation. Transform Kenya. Empower our nation. Transform Kenya, brought to you by Standard Group in partnership with the National Hospital Insurance Fund NHIF, Ministry of Health, Cosmos, Jubilee Insurance, Amref Health Africa, the Nairobi Women's Hospital, and Strathmore Business School.